Committee on State and Local Government will come to order. It is Tuesday, March 12, 2026. The time is 12:37. A quorum is present. First up on the agenda is Senate File 3860. Senator Johnson Stewart, whenever you're ready, you may proceed.
Thank you, Mr. Chair. Thank you, members. Thank you for hearing Senate File 3860. Which is a simple I shouldn't say simple, a compensation council date change. The compensation council's duties include determining constitutional officer and agency head salaries. The 24 members are appointed by the judicial branch, governor, and 4 legislative caucuses. Appointments to the council are to be made in January of odd number years, and final determinations are due April 1st. The LCC, as it's known, does the best they can to get the council started with as much time as possible for the members to meet and deliberate. However, in the last 2 biennia, they have not been able to start their work until March. This proposal would extend the deadline for the report on agency head and constitutional officer pay from April 1st to May 1st. Which would allow more time for analysis and deliberation amongst the council, with the final report still due during the legislative session. So with me today to answer any questions or concerns the committee might have about the bill is Ms. Dory Leland, Enterprise Director, Enterprise Workforce at Minnesota Management and Budget. Thank you, Mr. Chair.
All right, to the testifier, please state your name for the record and you may begin.
Good morning. Afternoon. Thank you, Chair, members of the committee. My name is Dory Leland. In my capacity as the Director for Enterprise Workforce Development, I also oversee compensation. The purpose of this bill is a very narrow one. This council has a very important job of making decisions about pay for constitutional officers and agency heads. But it's a large committee. It can take a while for them to get appointed, and then there's a lot of data that they have to consider. Our intent with this bill is just to move that deadline out a month. Only a month because they can only make recommendations, not decisions on judicial salaries, and so it still needed to be within legislative session to enable the legislature to take a vote related to judicial officer salaries. But there's no change to the duties or the composition of the council. The only change in this bill would be to move that deadline out by 1 month.
All right, thank you. Members of the committee, any questions or comments? Senator Barr.
Thank you, Mr. Chair. I'm kind of curious. So the budget year is the odd number year, and we're moving this to May 1st. Just to make sure I've got a total grasp on this, your recommendations for all of the salaries, or is it just they all are specific for like May 1st? You're talking like this year, we're out on the 17th. We got to have a budget in place before that. So I'm kind of curious of how truncated our ability to actually fund these salaries would be by moving this back. And that, so is it very specific? We got to get an idea ahead of time? Just kind of walk me through that, please.
Senator Johnson Stewart or Ms. Director
Yes,
Leland?
thank you, Mr. Chair. I'll turn to my testifier.
Chair, members of the committee, thank you for the question. The recommendations, the way that they are now, is that when they meet and have the decision by April, it's for a salary that would go into effect in that July and then the subsequent July. And so the decisions would still need to be made in that odd-numbered year during the longer of the 2 legislative sessions.
Okay, thank you. Senator Barr.
Thank you, Mr. Chair. That's kind of my point. If it goes into effect the 1st of July, we're not here to fund it. We have to actually put it in the budget that we're going to fund these salaries. And we usually try and have the budget done before the last minute, and try and get it all prepped. So that was kind of we're pushing this back closer and closer to the end of session where we would have to actually fund the salary. It's not like whatever you guys say, what you say we have to fund, but we have to put it inside of a bigger budget. And that was kind of my point. And so I guess the question is, we're going to be down to May 1st through the 3 weeks, approximately 2.5 to 3 weeks before the end of session, before we'd get and have to put this into the budget. So we'd have to put some kind of a placeholder in there. And when you start, next year, the budget forecast shows us in a shortfall or a structural imbalance. So that was kind of my question, is that when we get this down to 3 weeks, why would we want to make this hard for ourselves that way?
Senator Johnson Stewart or Director Leland, maybe like a walk through the timeline with us.
Sure, Chair, members of the committee, that's true. It would be a truncated timeline, and there would have to be some kind of placeholder. That would be one of the impacts, that there would be less time to make those budget decisions by the time the recommendations would come out.
Mr. Chair, I just want to offer up. Thank you. So the appointments are made in January of odd years, so those are budget years. Final determinations are due April 1st. From what I've had prepared for me, it says that this commission does the best they can. However, if you can imagine, if we're making the appointments and they may not be due until April 1st, then it's hard to know, get all the information together. The reason that they brought this bill to me is because there have been some delays, and I cannot speak to them in detail, but they haven't been able to get them in the last 2 biennia until March. And so this does truncate it, but however, I think this is simply to acknowledge that with this, the final determinations made April 1st, that we already are, to allow them to extend the deadline to May 1st, doesn't mean you have to turn it in on May 1st. It means that they're within their time period allowed, and I would guess that that's just based on how fast they can move with the appointments and the salary determination. Do you have anything you want to add?
No, all that is accurate.
Okay.
Senator Barr?
Thank you, Mr. Chair. I'm not disputing that you get, your end is, maybe we can move the other end. I'm just saying, when we do a budget process, we're going to have a problem. So I'm not disputing that we have an issue that we need to take care of. So maybe we can move the other end so they have more time, but I'm guessing that that's not workable because the bill talks about September 1st and the even number year compensation council must submit, so the recommendation says maybe we need to work on that. They've submitted and must be confirmed or whatever by such and such a date, so you guys could start your work a little earlier on the compensation council. Just a suggestion, but I totally agree we got a problem. So thanks.
Okay. Maybe the second testifier, please state your name for the record.
Thank you. Thank you, Chair Jung and members. Eric Anderson, Government Relations Director at Minnesota Management and Budget. I think the clarification on the timelines around the appropriations related to this would be that because for the constitutional officers and the state agency heads, the council is making determinations, that looking for that limited number of individuals involved, those potential changes in those salaries are not as material for the budget process that the legislature is completing at that same time. So we don't necessarily think for this limited group of individuals that they necessarily would need a different appropriation for the agency to accommodate those changes.
Okay, thank you. Any other member questions or comments? And with that, seeing no further discussion, Senate File 3860 is laid over for possible inclusion. Thank you, Senator.
Thank you,
Johnson.
members.
Next up, we have Senate File 1201, Senator Kunesh. And looks like you also have an amendment for us. Is that correct?
I do. I have the A.
Senator Kunesh, to your bill.
Thank you. The A4 amendment. You want to do that first, or should I talk about my bill?
The A4 amendment, Senator Johnson Stewart moves the A4 amendment. All those in favor say aye. Aye. All those opposed say no. The amendment is adopted. Senator Kunesh.
Great, thank you. Members and Chair, Senate File 1201 directs the Legislative Budget Office to collect information from school districts on the details of the health insurance plans that they are offering to their employees. 9 out of 10 schools are experiencing staff shortages, and the high cost of affording health insurance is a driver behind that statistic. This year started with 3,200 teachers in Anoka-Hennepin, the largest school district in the state, and they were on the verge of a strike. The big issue wasn't working conditions or salaries. It was the spiraling health insurance costs. One teacher told reporters his premium had jumped 22% in a single year. He was paying $1,000 a month just to keep his family covered. But escalating healthcare costs are not just the big district problem. In Spring Valley, a sixth grade teacher at Kingsland Public School that has 44 teachers and just 500 students said it plainly when her carrier announced a major rate hike like, either I get insurance or I get a paycheck. That same story is playing out in Blooming Prairie, Stewartville, Castle-Mantorville, Pine Island, and many more districts. This bill and what this bill aims to do will help the legislature understand the statewide picture of health insurance increases that are the effect that they are having on our school district budgets. The survey will provide district-level data about employees and potential enrollees, the plan offerings and the actual values, and plan financials such as district and employee expenditures as it relates to health insurance. In this committee, we are stewards of our public dollars as it relates to education, and this is something I'm very proud of. We need to be asking ourselves the question around how much of our public money is flowing directly to health insurance companies and insurance brokers. This bill will help us answer those questions, and I would appreciate your support.
Thank you, Senator Kunesh. And are there testifiers that you have testifying to the bill today?
Yep.
Okay. We have listed on there Joey Matthews from Valley Middle School, ISD 196, and Lori Goff from St. Michael Albertville School District. And as you make your way, please state your name for the record, and we'll start off with, is it Joey Matthews? All right, you may proceed.
Thank you, Chair and members of the committee. Thank you for having me here. I was lucky enough to get a sub today.
Oh, yay.
Which is a big deal always in our classroom. My name is Joey Matthews. I'm a sixth grade teacher in 196, actually at Valley Middle School. Over the last few years, educators in our district have received salary increases of about 3%. During that time, health insurance costs have risen by roughly 14%. In real terms, this means that many of our educators are taking home less money, even though they have negotiated raises. A colleague recently shared something that stuck with me. When our 23-25 contract was settled, educators received about a 2% raise. It wasn't a large increase, but it was an increase. When their paycheck arrived, and with health insurance premiums that time went up 18%, the raise vanished. What should have been a step forward instead felt like standing still, and for many, falling behind. And this story is now common all across our educators in Minnesota. Statewide school districts are seeing double-digit premium increases, including 18%, 22%. Butterfield, Odin, for example, 30%. And New Ulm, 54%. This is even through the bargaining process. These rising costs strain educators, district budgets, and the communities that support them. That's why SF 1201 is so important. The bill does not create a new reporting system. Districts already maintain about 95% of this data through insurance bidding and the bargaining with their local unions. 1201 simply requires this information to be reported consistently statewide so policymakers such as yourselves and the public can better understand how health insurance impacts Minnesota's public schools. Without clear data, it is nearly impossible to understand the full scope of the problem or evaluate the solutions. Without this data, any statewide health insurance plan will be based on guesswork. With it, Minnesota can seriously explore long-term strategies like a statewide health insurance pool for public school employees. At its core, this bill is about transparency and good policy making. If we believe policies should be data-driven, then collecting the data should be the easiest vote we take. SF 1201 is that vote. Thank you for your time and your consideration.
Thank you. Next up, Ms. Lori Goff. Please state your name for the record, and you may begin.
Thank you, Chair and members. My name is Lori Goth, and I'm a special education para for the St. Michael Albertville School District. I provide academic support in general education classrooms, and then I also run our resource room where students can come to get extra help. There was a time when education support professional jobs were sought after because of the good pay and great benefits. But after 25 years of underfunding by the state of Minnesota, our wages and benefits have not kept up, and positions like mine are hard to fill. When bargaining, the district comes to the table, says this is your budget, wages, or health insurance. Not everyone takes the insurance, but everyone takes the wages, so the insurance gets more expensive and the plans get worse. After decades of disinvestment, my insurance is, well, bad. I'd like to tell you about my son. One day he woke up and couldn't see out of his right eye. After many appointments with many doctors and specialists, and patiently, also known as agonizingly, waiting for test results and numerous MRIs, we found out he has a rare eye disease. It took a year, but the doctors found a way to stabilize it. Unfortunately, our insurance will not cover the medication the doctor prescribed. Instead, we are forced to use a medication that is for children with cancer who are waiting to have a bone marrow transplant. It suppresses the immune system and has possibly devastating and irreversible long-term side effects. He needs to be on this for at least 3 years and possibly forever. This medication isn't covered by insurance either, but it's $168 a month out of pocket rather than $7,000. I work 3 jobs to pay for medical expenses, and my son may still lose his sight. Imagine telling your child that you can't afford to keep them healthy. I don't want to just be one more sad story, but I do want to put a face to a statewide problem. ESPs in every district in our state are struggling to care for our families. This is a statewide problem, and it needs a statewide solution. This report will help us understand the full scope of the problem and what it would take to provide us with the kind of health insurance that would allow us to care for the kids in our schools and our families at home. I encourage you to support this. Thank you so much for your time.
Thank you for sharing this with your story, ma'am. And with that, any of the committee members with questions or comments to the bill? Senator McQuaid.
Thank you, Mr. Chair, and thank you, Senator Kunesh, for bringing this bill. I'm on your, on the other bill that would actually just create this and fund it, but I think a really first good step is to at least get this report. It is just devastating what is happening to our educators and our support professionals. And frankly, it's mirroring what's happening to health insurance for everybody. And there's just so many ways that we hear this isn't working. And you know, I want us to fix this for teachers and support professionals, but I also want us to fix this for everyone, because I've never had anyone come in and say, you know what, insurance is great and it's working so well for me. So I appreciate this first step for such a critical population of Minnesotans. Thank you, Senator Kunesh.
Next up, Senator Johnson Stewart.
Thank you, Mr. Chair. Thank you, Senator Kunesh. I just want to emphasize, one of the testifiers glossed over it, but every one of our, well, I don't know if it's everyone, but nearly every one of our school districts negotiates its own health insurance, which to me is crazy. And I have been looking at this since the first time I was in the Senate for a way for all public school teachers to be covered under our state employee health plan. One of the challenges is getting the data, so thank you very much. That's something I will be looking at. It's difficult to compare and really make an assessment of how much money we can save, because I know we're going to be able to save lots of money if we move to this system wherein everybody is covered under one plan. So I I'm very hopeful that we get the data soon, and I'm in very much support of this. Thank you.
Next up, Senator Swedzinski.
Thank you, Mr. Chair. Question for the teacher: how arduous was it for you to get time off to come down here and testify?
To the testifier.
And then I have a comment.
Well, it's not so much taking the day off. That's pretty easy. But as far as subs, there is such a shortage. So I was lucky I was able to get one, but there's a lot of days we don't, and teachers give up our prep to cover.
So thank you, Mr. Chair. Your principal was cool with getting a
Yes, sir.
sub for you to come down here
Yes, sir.
and do your civic duty.
Yes, sir. I'm
Take a test.
very lucky to have an understanding administrator.
Senator Swedzinski.
Thank you. And I agree with what Senator Johnson Stewart said, and I wish we didn't have to go through this process, Senator Kunesh, quite frankly. I wish we didn't have to collect data, because every teacher I talk to, this is when I ask them how things are going. The last 3 or 4 years, it was a different answer, post-COVID. And now, all of a sudden, it was like some switch was flicked somewhere, and now it's our health insurance premiums are going through the roof, 18 to 22% is the numbers I'm hearing, and our salaries are being negotiated at 3%. So I wish we didn't have to do a study to wake people up. If you would just go talk to your teachers and ask them what, 1 or 2 or 3 issues are important for you, for us to work for on your behalf here at the legislature. This rises right up to the top, so I don't know why we have to do a study, but I'm grateful for your bill. I hope you can add me as a co-author to it, and because I see you don't have any right now, and I'd like to be a co-author. And so anyways, and thank you for bringing this awareness to all of us here at the legislature.
Senator Gustafson.
Thank you, Mr. Chair. I agree with Senator Swedzinski. We just need this information, and I do think it is going to be eye-opening once this is all compiled and then shared with everybody, because even though we're just talking about teachers and educators and schools right now, that is going to be that's a pretty healthy cross-section of our society, and we're all paying in insurance right now. Our health insurance, I have 4 kids. We still cover, except for the oldest, I guess she finally got her own health care, and honestly, it was such a noticeable difference, even though we still pay so much money per month for premiums, then our prescriptions, then every time you go to the doctor, and then they change up the networks, and oh, you went to the wrong one, and now it's $1,200 for a visit on one thing that you just can't afford to be sick anymore. And our system is broken. Our healthcare system is broken. And this hopefully, well, I support, of course, all educators and school employees getting health care. I hope that this will also be eye-opening to just everybody receiving the health care they need, because it is unsustainable the way it is. You just can't afford to get sick. And it's not just our state, it's just the country right now, no matter where you're at. You just can't afford to get sick anymore. You just don't have any money to pay for the medical care you need. So I'm very anxious to see the results of the study. Of course, I'm a yes on the bill, and thank you for bringing it forward.
Thank you, Senator Hamilton Yeager.
Thank you, Chair. Thank you for bringing this bill. Just to kind of echo what everybody else has said, I think anytime you can get especially public employees into a nice big pool, that's going to actually really help with the healthcare costs. It should bring everything down. As someone who's in CGIP, I've seen that firsthand. And I, kind of feel the same kind of way where it's like, I can't believe we have to go through this step, but I guess if we have to go through this step, we'll have a lot of really good data, and it's gonna be really hard to refute that data to get to the end goal. I think that we need to for not only our teachers and our educators, but our support professionals and all the other staff and workers in the schools. So thank you.
Senator Kunesh, any final words for the committee? And it looks like we're sending this to Education, Finance. Yeah.
Yep.
Senator Kunesh.
Thank you all for your support of this bill. I think we will get an eye-opener when it comes down and we look at all the different numbers and how these dollars, and remember these dollars are taxpayer dollars that are going towards the healthcare for educators and those staff. And so appreciate your support on this bill.
Thank you, and with that, Senator May Quade moves that Senate File 1201 be recommended to pass and referred to Education Finance. All those in favor say aye. Aye. All opposed say no. The motion prevails. Senate File 1201 passes to Education Finance. Thank you. And with that, members, our next testifier, he's currently held up in another committee. We'll take a quick 5 to 10 minute recess. We'll take a 10-minute recess. Thank you. The State and Local Government Committee will come back into session. Senator Klein, whenever you are ready, you may proceed, and I think you have an A11 amendment.
I do, Mr. Chair, and
Senator Klein.
it is not an author's amendment, so I will explain it to the committee. But first of all, apologies to the committee for making you wait. Thank you for the indulgence of hearing Senate File 3859. Members, this bill is about giving Minnesotans sound advice that is based in science and in our best medical expertise regarding vaccination practices. Federally, we have relied for years and generations on the Advisory Committee on Immunization Practices. Unfortunately, in the last year, that institution has been gutted of its original members and replaced with people who are not giving recommendations that are supported by established medical institutions such as the Academy of Pediatrics or the American Medical Association. This bill reconstitutes an advisory committee on immunization practices at the state level so that Minnesotans can at least get reliable information about what they should be giving to their children and what they should be taking themselves for vaccines. It is worth noting that this is not a mandate of any kind. Individual Minnesotans have the right to decide what medicines and what vaccines they are going to take. We simply want to ensure that they have access to the best science that Minnesota has to offer with regards to recommendations. Also want to point out to the committee that we actually had an advisory committee on immunization practices from 1991 through 2019. It was based on these same principles. We essentially felt that Minnesotans had good medical expertise within our state and had the ability and the responsibility to provide Minnesotans with the best advice they had to offer. That institution or that board expired in 2019 because we felt we could rely fully on the Advisory Committee of Immunization Practices at the federal level, but now the need returns. Mr. Chair, the A11, which I hope one of your members will offer on my behalf, tightens up the definition with the help of counsel, Ms. James, of the board itself, clarifies who will appoint these various experts to the board, creates reporting back to the chairs of the relevant committees, and creates a requirement that the board meet before a certain given date within the amendment. That's the purpose of the A11 if one of your members wants to offer it.
Thank you, Senator Klein. And with that, Senator McQuaid moves the A11 amendment. Or members, any questions or comments to the amendment itself? Again, Senator McQuaid moves the A11 amendment. All in favor say aye. Aye. All opposed say no. The amendment is adopted. Any further comments, Senator Klein?
Chair Jong, that is the bill, and now as amended, I'm open to questions of the committee.
Any questions or comments from members of the committee? Senator McQuaid?
Thank you, Mr. Chair. Thank you, Senator Klein, so much for bringing this bill. Having a 3-year-old and not being a medical professional, it is so hard to know yourself, everything you're supposed to know. That's just not possible. And we rely on our pediatrician and our trusted healthcare providers to tell us, like, what does the science say? We consult our pediatrician all the time. And so it is at a time when things can feel really rife with uncertainty. And, you know, I used to be able to look at like the CDC website and be like, that's what it is. I need that still. I need that. And Minnesotans deserve that. And so thank you for bringing this forward and making sure that we'll be able to have that, because you're a doctor. I'm sure you all the time are like, yeah, I already know. But for those of us who aren't, it's hard. And so this is just very needed. So thank you.
Thank you, Senator Klein. Members, any other questions or comments to the bill? Senator Coran.
Thank you, Mr. Chair. Senator Klein, you said it's not a mandate, but one of our notes says, and I was trying to find it in the bill, but that it would require routine immunizations recommended by the American Academy of Pediatrics and West Coast Health Lines, but I can't find it in here. Is that still in the bill, that it's mandated?
Senator Klein.
Chair Zhang, Senator Cran, yes. In fact, what I meant by it's not a mandate. It's no requirement that any individual Minnesotan take any vaccine, but it does require that those standard vaccines are covered by insurance, and that was an issue that was dealt with in my Commerce Committee where its jurisdiction lies.
Mr.
Senator
Chair, thank you.
Coran.
And Senator Klein, I mean, right, we all want to try and believe at some point who's making those decisions on what's a vaccine, what isn't a vaccine, and we all discovered a bunch. And so now to move to another commission, it's been almost impossible to have a commission, task force, or whatever that we've handed off in some realm of removing the responsibility to legislate here to a committee that almost always ends up to be ideologically driven, because there rarely is anybody that is a nonpartisan person, we hear it every day, or a citizen or the expert that doesn't have an embedded political ideology. And so you're upset with the current direction, and somehow this new direction is going to provide something that we can believe more in. And in the past, you had great faith in a system which we find out that most of all the conspiratorial things come true about the embeddedness of big pharma and the approval process and the secrecy about vaccines and prescriptions, whatever they are, any of the pharmaceutical development that they've withheld. And I think we probably all share that united hatred for that process and its heavy-handedness and the lack of transparency. And so this is a counteraction. You don't like that they've changed it. I don't like 72 recommended vaccines for a child either. And we're seeing healthcare issues like we've never seen before. So I don't think an advisory commission, it would be great. I would love to figure out instead of looking at it and always saying that, hey, we're going to have a nonpartisan group, because I've never met a nonpartisan person yet, that we have to look at it that it's equally partisan. put the conflicting factions on boards and those types of things, which we don't seem to do. And it would be wonderful if we could do that. But I just can't support it from the perspective of we don't like the results of an election, and we've all learned that we couldn't trust anything in the FDA process over decades. Is it perfect yet? I'm not sure, but I yearn for the day where we have a process which we can all trust. So thank you.
Senator Klein, any comments?
Mr. Chair and Senator Klein, I would simply guide the committee to subdivision 2 on page 4 and on page 5 that constitutes the membership of this committee. And I'll note that there is a representative from the Council of Health Plans, and there are representatives appointed by the American College of Physicians, American Academy of Pediatrics, American Academy of Family Physicians, American College of Obstetricians and Gynecologists. If Minnesotans receive this advice and they choose to believe that a different organization gives better medical advice than those individuals or more objective advice, then that is certainly their prerogative, but I certainly want to make this available for Minnesotans.
Thank you. Senator Hemmingson Yeager.
Thank you, Chair. Thank you, Senator Klein, for this bill. It's really interesting that we had a council like this, you said prior to 2019. So I find that fascinating, but I also find that consistent with what I've heard from our own Minnesota Department of Health. We have a nation-leading Department of Public Health, so I think that that's great that they are included in providing these recommendations in the best interest of our public health. I also really appreciate that we have medical professionals that have their medically accurate information, their expertise, their education. And as a geneticist, I really appreciate the fact that this is based in scientific evidence and doing what's best to help Minnesotans make the best decisions they can. Thank you.
Senator Johnson Stewart.
Thank you, Mr. Chair. Thank you so much, Senator Dr. Klein, for bringing this forward. At a time when, as a parent, as a human with my own body, I can rely less and less on the federal government to give me sound medical direction. I'm so grateful my children are grown and I raise them and immunize them fully based on trusted scientific recommendations from my federal government. I'm so glad that that time is gone and I was able to do that in a time when vaccines weren't politicized. I'm so glad also to be in a state where we have this kind of legislation, and at least in Minnesota, we will have a Minnesota Science-Based Vaccine Advisory Council. to fill in where the federal government has gutted our vaccine advisory boards. I mean, I can't even believe some of the stuff that I hear happening at the federal level. Measles outbreaks, polio possibly coming back. There are some things that are objective. There are some things that are trusted. I fully trust the recommendations of my physician as they guided me through the immunization process for my own children. And I'm very grateful for your expertise in assembling this bill and for the expertise of those who will make up the advisory council. I think it's critical that we create some of these safety nets in each of our states as the federal government just falls very short in its responsibility to provide sound medical advice. And I'm grateful for this bill, and I urge everyone to support it for the sake of our children and for ourselves.
Thank you. Any other questions or comments? Senator Drazkowski.
Thank you, Mr. Chair. Thanks for the bill, Senator Klein. As I look at this, I guess one question I would have is how much are our healthcare costs going to increase because of this bill? Do we know?
Senator Klein.
Mr. Chair, Senator Drazkowski, fiscal note is pending on this bill.
Senator Drazkowski.
Thank you, Mr. Chair. With Senator Klein, that was my second question, whether we have a fiscal note, and apparently we don't, and this will be the second Finance Committee it's gone through without a fiscal note. Mr. Chair, members, Senator Klein, we never used to do it this way. I'm seeing bill after bill after bill come through here without a fiscal note, and we have no idea what this is going to cost at this point in the process. This is irresponsible legislating. And Senator Klein, this isn't the first bill we've had like this here, if that makes you feel any better, but we shouldn't be doing it this way. And so, Mr. Chair, I hope we can put a lasso around this somehow and get some control over the bill so that when they do come to committee, they have the fiscal information in front of us so that we can evaluate that as we decide to pass the bill or not, or lay it over and include it in the omnibus bill or not. All the eyeballs in front of us here today should be on that fiscal note, and we can't get them on there if we don't have it in front of us. So, Senator Klein, the way this bill looks to me, you're going to have two additional groups of people that will provide recommendations on vaccines with which people who are buying insurance in this state will be mandated to pay for. Is that accurate?
Senator Klein.
Mr. Chair and Senator Drazkowski, so once again, the issue of insurance mandates was handled in the Commerce Committee, which is its jurisdiction. It turns out that vaccines are broadly covered by insurance currently, and this would have minimal impact on those operations.
Senator Drazkowski.
Thank you, Mr. Chair. So, Senator Klein, is there anybody in the health insurance industry that's providing a handout or some sort of way for us as legislators to know that? I mean, on its surface, it looks like there's going to be a lot more vaccines that are mandated to be paid for by people in insurance, and with the 72 or 75 state mandates that we have now, this will give us even more mandated costs to insurance. The only direction it can go is north, as far as I can tell. So I'd be curious to see something from the industry or whoever is promoting this to let us know how much more health insurance costs are going to go up for Minnesotans because of this bill.
Senator Klein.
Again, Senator Drazkowski and Mr. Chair, this is largely the purveyance of the Commerce Committee, but I will just point out that we included within this, at the recommendation of the American Council of Health Plans, language around defrayal, so that if individual premiums do increase at all based on this legislation, the state of Minnesota is required to defray those costs. Again, it is my understanding in conversations with the industry, the insurance industry, that they are already covering standard vaccine recommendations. This simply codifies that and will not change their expenses.
Thank you, Mr. Chair.
Senator Drazkowski.
Thank you, Mr. Chair. Thank you, Senator Klein. So, I mean, the defray language, so, so taxpayers are going to pay for the cost. It's still going to cost more for health insurance for people throughout Minnesota with this bill. And if the defray clause gets enacted or gets exercised, the taxpayers are going to have to pay for it. It's still more on the pile of costs, whether it's coming out of this pocket or this pocket. I'm done, Mr. Chair. Thank you, Senator Klein. I'll be voting no.
Thank you. Senator McQuaid.
Thank you, Mr. Chair. Senator Klein, I'm wondering, you said this existed from 1990 to 2019. I'm wondering if either you or if fiscal staff might give us a ballpark of what this cost when we had it in place.
Senator Klein or fiscal staff?
Mr. Chair, I'll defer to Mr. Erickson.
Mr. Chair and Senator McQuaid, I do not know offhand this one would be outside of any jurisdiction that I've covered since then. I'm sure I could look that up and get back to you if that would be helpful.
Thank you, Senator McQuaid.
Thank you, Mr. Chair. That would be great. It's a known cost that we've had before. And Senator Klein, I'm sure you do a very good job of being a doctor when you're a doctor and a senator when you're a senator, but if I could just beg your ear for a little bit. Correct me if I'm wrong, but 20% of people, unvaccinated people who get measles end up hospitalized. Am I correct?
Senator Zhang.
Senator Klein.
Mr. Chair, Senator McQuaid, that sounds about accurate.
Senator McQuaid.
Thank you, Mr. Chair, and thank you, Senator Klein. So just as the Commerce Chair, is it more expensive to pay for 20% of children to be hospitalized or for a vaccine?
Senator Klein.
Mr. Chair, Senator McQuaid, I will say that the costs being incurred by the state of South Carolina currently, as their active measles cases surpass 1,000, are extraordinary. And those are unplanned costs, and I'm sure have a significant impact on their budget.
Senator McQuaid.
Thank you, Mr. Chair, and thank you, Senator Klein, for that. I think, yeah, I'm 40. I almost said I'm 39. I'm 40, so I was born in 1986, and I don't remember measles. And I think one of the consequences, one of the benefits of such a successful vaccine program in the United States of America is that we do not remember how truly awful some of our vaccine preventable diseases are. And unfortunately, there's so many communities, you brought up South Carolina, Utah, Texas, that are discovering for the first time in their generation how truly horrible these are. And I think it's worth noting too that there are routine horrible things like spinal taps that kids had to endure when they went to the emergency room because they weren't sure, is it measles, is it that doctors don't have to do anymore because we had eradicated measles, for example, and we have hopefully eradicated polio. And so I worry more, about my kid getting a vaccine preventable disease, right, and getting not just that bout of illness, but also the lifelong consequences that come from that, immune amnesia, right? They can lose all their immunity to all the other things that they've caught before, encephaly, paralysis. I mean, there's so many things that come along with it, but also that healthcare costs are going to skyrocket because you have all these unplanned, very serious diseases, preventable diseases. So I worry more about what it will do our healthcare costs to not keep people healthy than what it will do to keep them healthy. So I again appreciate your bill, and I'll be supporting it.
Thank you, Senator McQuaid, and thank you, Senator Klein, for bringing forward this bill. I think a lot of us look forward to your leadership in this, and so I look forward to seeing this bill passed. Do you have any final comments for the committee?
Thank you, committee. And again, my apologies for making you wait for this bill, but I appreciate your attention to it and the thoughtfulness from both sides of the aisle. This really is not just theoretical. Again, there are more than 1,000 measles cases in South Carolina today, a disease that by all rights should have been eradicated a generation ago. That outbreak can be entirely attributed to misinformation about vaccines. And this bill aims to correct that, aims to save the lives of Minnesotans, and I urge your support.
All right, seeing no further discussion, Senator McQuaid moves Senate File 3859 to be recommended to pass, as amended, to be recommended to pass and referred to Health and Human Services. All in favor say aye. Aye. All opposed say no. The motion prevails. Senate File 3859 passed to Health and Human Services. Thank you, Senator Klein. And thank you, committee members. And with that, the committee is adjourned.